Hello, my name is Dr. Steve Sharfstein, and I'm President and Chief Executive Officer of the Shepherd Pratt Health System in Baltimore. And I edited the textbook of hospital psychiatry, which is the first textbook focused on hospital practice in the last 10 years. It is an excellent compendium of practice. The book covers many different aspects of hospital psychiatry. Hospital psychiatry has changed radically in the last period of time. Now it's mostly focused on short-term crisis stabilization, but what has evolved over the last 10 years are a number of subspecialty areas in hospital psychiatry. And each aspect of these subspecialty areas is covered in this textbook, in the textbook of hospital psychiatry. We have chapters on children and adolescents, on geriatrics, chapters on eating disorders and trauma disorders, chapters on treatment-resistant psychotic disorders. All of these aspects of hospital psychiatry today mark the evolution of care in the inpatient setting. But the hospital today is much more than the inpatient stay. And this textbook carries forward the notion of a hospital without walls. The care that's provided to patients in the hospital continues. If they're in the hospital for a week or 10 days, they're often stepped down to day programs, and there are chapters on day treatment, and various outpatient programs and community-based programs, and programs that are oriented toward recovery and rehabilitation in various settings, in homes, in centers, that in fact replicate what hospital psychiatry was once like 25, 40 years ago, when everything was taken care of in a long hospital stay. Today the stay is short-term, and it takes place in the hospital, the 24-hour stay, but illness is long-term, it's chronic, and as a result care must take place in settings outside of the hospital, and the hospital often is providing that care. For individuals who practice in hospital settings, who often need to see their patients as they step down to the day programs and outpatient programs, this book, I think, is an invaluable guide to how the best practice works in various centers around the country, not only at Shepherd Pratt, my hospital, but at hospitals such as McLean, Menninger's, Cornell Westchester, Butler Hospital. These hospitals are at the leading edge of the practice of hospital psychiatry. And it's not just psychiatrists who would benefit from reading this book. Mental health professionals who work in the hospital, social workers, psychologists, nurses, all have specialized chapters in the book that focus on their practice, and they're very much part of the hospital team. And most critically, patients, consumers can benefit from this textbook as they understand what the appropriate role of the hospital is, what can be expected from a hospital stay, and that, I think, is also very valuable for the entire mental health community. This is a unique book. This is the first textbook of hospital psychiatry in a long time. It's one, I think, that will be used not only in academic centers, but in community hospitals, in specialty hospitals around the country. Thank you very much.